Hi, I'm Clare. I'm an occupational therapist here at Cypress. We have 3 occupational therapy assistants also who help run all the groups. So we sort of coordinate and attend some of the reviews and obviously work one-to-one with people, and that can be and complete assessments. We might liaise with social workers as well, looking at when people come closer towards their discharge. We're looking at maybe supporting with a package of care in the community so that it can help prevent relapse really. Mental health is all really about how we think and how we feel and we behave. As an OT, I kind of look a little bit deep about sort of what underlies that, as well as the medical condition that affects it, and also look at how their self-efficacy, how they view themselves in their competence with occupation. So we'll look at factors that influence, by occupation I mean everything that they do. So from sort of self-care, which is obviously looking after yourself, washing, dressing, but equally it could be shopping, it could be finances, it could be keeping a habitable home, those kind of things. We look at people's cognition, we look at whether there are any communication needs, any sensory needs. So it's a really holistic assessment, and then we look at strategies to obviously address those, and with the underpinning mental health condition in view as well. Anxiety is feeling tense or anxious severely to a point of actually it actually stopping you engage in any occupation. So it's so debilitating. Anxiety is a normal thing that people experience, and it's okay. Symptoms of anxiety it's when our brain is on that flight and fight and freeze kind of alert, and that can mean that people are in that heightened state all the time. There's lots of different types of anxiety. We have generalised anxiety, social anxiety, health anxieties, which is being particularly prevalent with COVID at the moment, panic attacks, people can have panic attacks, obsessive compulsive disorder is a type of anxiety, and it can, I talked about the anxiety and depression mix, and you can have bipolar or something, which means you're and that can affect your anxiety levels as well when you're kind of hitting your mania, and then we look at a CBT approach quite often, which obviously looks at a cycle. People get into a pattern of behaviour, and they don't often realise, they don't necessarily know exactly, they can't necessarily verbalise their emotion or how they're feeling, but actually they've got their thoughts and their feelings or emotion and their behaviour are all interlinked. And it's a case of looking at those thoughts and looking at the trigger to those thoughts and trying to get to the root cause of the anxiety. Well, the sorts of things that we do at Cypress, which are great for people to carry on doing when they're home, is we look at, like I mentioned earlier about the CBT, we look at challenging that negative self-talk, or changing illogical or distorted thinking patterns, or changing unhelpful thinking patterns, should I say, that stop you from doing the things that you enjoy doing. As an occupational therapist, meaningful activity is our goal, and a lot of people go away from that. So actually engaging in something that's meaningful to you, engaging in a hobby that's relates to your values and your interests, and that's important to you. Other support could be obviously just there's some mental health support groups out there. There's Samaritans, there's TalkWorks, there's other people who you can talk to if you're not in such a severe crisis, if you feel able to talk. There are, when people leave here, we look at groups. There's Women's Wellbeing, there's Andy Mann's Club, there's lots of things through Age UK is quite good for slightly older adults, and they can often signpost, or Citizens Advice Bureau can help and signpost. There's lots of people out there